This Courage presentation explains how to understand and prioritise the child protection challenges happening in your community. Now that we have identified that there are child protection challenges taking place in our community, we need to understand what these challenges are and what impact they are having on us and the community around us. Some useful tools to help you identify, understand and prioritise your child protection challenges, which you can download from the Courage Child Protection website or order a printed version online, include a pack of Courage Disempowerment cards, which is the purple pack, watching this Courage movie, or downloading and presenting the Courage Child Protection Challenges presentation. The purpose of this exercise is to empower your participants and community with knowledge and insight about the child protection challenges happening around you. Knowledge and insight are critical to solving any problem and are an important driver of personal and community empowerment. They are about learning and education, about openness and transparency. Knowledge and insight helps us to support concepts such as human diversity and rights. In the world of child protection, they often come from monitoring, measurement, and evaluating what is happening around us. Knowledge and insight are about searching for the truth every day and being open to new ideas and new ways of thinking about the world. For this exercise, you will want to ask your participants to go through each Child Protection Challenge card to understand what the challenge is all about. The first question they should ask themselves is whether this Child Protection Challenge is happening in their community or not. If it is not happening, they should place the card in a Does Not Exist pile. If the challenge does exist, they should ask themselves if this is a high, medium or low priority challenge in their community, and then place the card in the appropriate pile. This is a very subjective exercise, as community members are being asked for their opinion on the impact or severity of the Child Protection Challenge. So if there is disagreement, they should discuss why they think the way they do as a group. At the end of the day, each participant is an expert on their own community and their views matter. If you have cards, you can just make 4 different piles. However, if you are writing your answers down, write them into 4 separate columns as illustrated. At the end of the exercise, you can then try to prioritize them from highest to lowest in each of your high, medium and low columns. Different child protection challenges happen at different stages in a child's life, from in utero to when they are born, become a toddler, a child, a tween, a young teen, an older teen, or a young adult. Before children are born, they are exposed to challenges such as drug and alcohol abuse by their mother in utero, which impacts on a baby's mental and physical development in what is termed fetal alcohol spectrum disorder. There is also the challenge of 3rd trimester late abortion. At birth, children are at risk of being exposed to the HIV virus and to poor health services that place their life and well-being at risk. They are also at risk of being orphaned given the high rate of maternal death for HIV-positive mothers. Small babies are also at risk of neglect. In the first weeks and months following birth, children are at the highest risk of being abandoned by their mothers in either safe or more often unsafe spaces if they are unable to care for them, often due to extreme poverty. Child trafficking is a challenge due to their vulnerability, and abandoned children are often denied birth certificates or identity documentation. As they become toddlers and start to question their parents or act out, children are more at risk of physical abuse, attempted murder, and issues such as the impact of bad nutrition start to emerge. When children start going to school, they become subject to issues such as bullying, emotional abuse, and corporal punishment. There are also issues around no special needs support for children with disabilities due to lack of resources. As they move into their tween years, issues such as sexual abuse and rape emerge, as do child labor and commercial sexual exploitation. As children reach puberty, issues such as harmful cultural practices, such as female genital mutilation or harmful male circumcision, and child marriage become an issue. Other challenges such as street children and unaccompanied minors, refugees, and child-headed households emerge, and children are exposed to dangerous environments such as gangsterism and crime. As vulnerable children become older teens, issues such as mental health, depression, anxiety, and suicide attempts start to emerge. It is also a time when vulnerable children start to engage in risky sexual behavior, resulting in teen pregnancy, using drugs and alcohol, and experiencing abuse in the justice care system when they fall foul of the law. We will now go through each of the 49 child protection challenges identified by Courage to understand them and prioritize their impact on your community. You will need to decide if they are happening in your community or not, and if they are, how you would prioritize them as high, medium, or low problems. It is also important to identify if there are any child protection challenges missing from the ones that Courage have identified. If there are, be sure to share these with your group and with the Courage team. The first challenge is drug and alcohol abuse in utero. This is when a mother consumes excessive amounts of alcohol or drugs whilst pregnant. This can lead to a brain disorder called fetal alcohol syndrome or spectrum disorder in an unborn child, and is often a result of ignorance by the mother of how what she consumes impacts on her unborn child. An unborn child is still entitled to rights, and this is a violation of their rights to live a full and happy life, as they will be born and have to live with an incurable mental disability that will impact severely on the quality of their lives. Late termination of pregnancy is the legal term for late abortion, or an abortion that takes place in the third trimester of pregnancy after 6 months gestation. The mother is often given pills by illegal abortion practitioners, poison or harmful traditional medicine that brings on contractions. It can sometimes lead to the death of the mother and very often the death of the child. It is a criminal act, and the mother can be charged with concealment of birth if the child dies. Mother-to-baby HIV transmission, which renders a child HIV positive, can happen through the birth process if the mother is HIV positive. However, this can be prevented with antiretroviral or ARV treatment. Natural birth has a higher risk of HIV transmission than caesarean section, as the child does not pass through the birth canal when born this way. It is important that mothers who are HIV positive are counseled before and after they give birth to ensure that they protect their child from getting HIV. Breastfeeding can also be a risk, but this risk is prevented through exclusive breastfeeding rather than mixed feeding and with the support of ARV medication. A child becomes a full orphan when both their parents have died. If there is no extended family to take care of the child, it is better for the child to be adopted into a family where they can be looked after and belong. The HIV and AIDS pandemic has resulted in many orphans around the world. The challenge with parents dying of HIV and AIDS is that their children often have to live with the stigma of this disease. In some instances, children have been left in homes to look after themselves, in what are termed child-headed households, where older children look after younger children in a family. Children who have been orphaned are at risk of neglect as they have lost their primary caregivers. Abandonment is when a child has been left by their biological parents or caregivers in a safe or unsafe space for a period of more than 3 months without any care. In some countries, child abandonment is a criminal act. Unsafe abandonment can often lead to the death of a child. No primary love or attachment is when a child does not have a family or primary caregiver who takes care of them and their needs. The child develops no primary attachment to a caregiver, and this can lead to long-term psychological trauma and mental health challenges. Children are at risk of not developing primary attachment in places of temporary rather than permanent care, such as in the foster care system, children's homes, and child-headed households. No registration or identity happens when children are denied a birth certificate, identification documentation, or citizenship through a passport. This is a basic children's right, but it is a major problem for children who have been abandoned or who are refugees. It can lead to feelings of rejection and neglect and a lack of personal identity. It also prevents the children from gaining access to important child protection systems in health, education, and welfare. No belonging to a family or community is when a child is denied access to a family, registration, a name, identity, or nationality. They are denied the right to belong to a community and are treated as refugees who don't belong anywhere. They are often cut off from their cultural roots and are denied access to services. Child trafficking is when a child is treated as a commodity that can be bought or sold. It can include illegal adoption, child marriage, prostitution, the removal of a child's body parts for sale, and using a child to create pornographic material, or enslaving a child for the purpose of sexual abuse or child labor. A child lacks safety and security when they have no care or protection. Children are especially vulnerable in the wake of natural disasters, civil unrest, and war. Vulnerable children are also at risk of being trafficked if they have been orphaned, abandoned, or if they have no access to personal registration or identity documentation. Poor nutrition is a major challenge for children around the world. This can include hunger due to not having anything to eat, often driven by poverty, but also relates to being fed the wrong food or not being given a balanced diet, which can lead to childhood obesity or nutritional deficiencies. If a child is not given regular meals and their nutritional needs are neglected, it can lead to long-term growth stunting and a range of physical and psychological challenges. All children have a right to basic health care. However, this right is often denied, even at birth, where many children experience trauma or are not given access to antiretroviral treatment if they have been exposed to HIV or AIDS. No or poor health care also includes not vaccinating your child against harmful diseases or giving them unregulated harmful traditional medicines. Probably the greatest child protection challenge experienced by children around the world is that of poverty and inequality. Many children are born into households that live below the poverty line. They have no access to food, a stable home, healthcare, or reliable care and support. Their poverty also makes them the subject of inequality and discrimination. Physical abuse relates to hitting a child with an object with your hands or feet, burning a child or shaking a child, often a toddler, excessively, so that it causes them physical harm. Physical abuse is often a result of general domestic violence, and where children are afforded no care or protection in their home. Murder and attempted murder relates to killing a child or attempting to kill a child either through using a firearm, strangling them, hitting them, poisoning them, or abandoning them in an unsafe space where they are unable to look after themselves. A perpetrator will be found guilty of murder or attempted murder if they intended to harm the child and/or end their lives. Neglect relates to not caring for a child that you are responsible for, either as their parent or caregiver. It involves not feeding a child sufficiently or correctly, not taking them to a doctor, clinic, or hospital for regular checkups or when they are sick, exposing them to drugs and alcohol, and not looking after a child's personal hygiene when they are too young to do it for themselves. It also relates to not registering and taking them to school, and generally not supervising, caring, or providing for them as they develop and grow. Emotional abuse relates to not caring for or loving a child that is your responsibility. This can also relate to not feeding, changing, or holding a baby or child. It also includes threatening, scaring, or discriminating against a child, ignoring or isolating them, or restricting their movement. Emotional abuse is often a result of domestic violence and where a child is afforded no care or protection in their home. Sexual abuse or assault refers to fondling or unwanted sexual touching of a child, forcing a child to perform sexual acts such as oral sex or penetrating their perpetrator's body. Rape refers to any penetration of a child's vagina or anus by any body part or object, or oral penetration by a sex organ without the child's consent. Each country has a legal age of consent. In most cases, this is 16 years of age or younger. This means that if a person older than 16 years has sex with a child who is 16 years or younger, they can be found guilty of statutory rape. Incest refers to sexual abuse or rape conducted by a close family member, such as a parent, sibling, or grandparent. Sexual abuse can also refer to the sexual harassment of a child, the creation of child pornography, or forcing a child to watch pornography. Sometimes sexual abuse and rape is linked to harmful cultural practices, such as the incorrect belief that raping a child will cure a disease such as HIV and AIDS. All children have a right to education, but this right is often denied, either through not offering access to educational institutions or discriminatory practices such as denying school to girl children or undocumented refugees. A child is also denied an education if they experience abuse at their school, such as through the use of corporal punishment. Not registering or taking your child to school is a form of neglect. Denying a child access to play or recreation is a form of abuse and neglect. All children need to play to develop into well-rounded human beings. It is a critical part of child development. Denying children access to recreational facilities, to safe and secure places to play, or opportunities for physical development is a major child protection challenge that also restricts their social interaction and development with other children. All children have a right to personal development at a physical, mental, emotional, and social level. Children also need to develop morally, and it is the responsibility of their parents or caregivers to ensure that they have opportunities for personal development and growth throughout their childhood. If a child is born with or develops a physical, mental, learning, or social disability, they are entitled to special needs support. This also includes ensuring access to public institutions and environments such as ramps for wheelchair users, additional support for blind and deaf children that accommodates for their lack of sight or hearing, and the equipment or therapeutic support they need in health, education, and society to become full and participating members of their community. A lack of service delivery when it comes to special needs support is an infringement of their basic human rights. Child labour is work that deprives children of their childhood, their potential, and their dignity, and that is harmful to their physical and mental development. It refers to work that interferes with their schooling or education, and that leads to physical, mental, and/or moral decline. It also refers to work that is dangerous to the child, or that is conducted in a hazardous workplace. Not all work conducted by children is considered child labour, as it can be a means for personal development and family support. However, if the work impacts negatively on the well-being of the child, it should be assessed accordingly. Corporal punishment refers to the physical punishment, often through flogging or caning with an object, of a child in the home, school, or institutional environments. It is illegal in many countries. Corporal punishment is often associated with victimization, abuse, and domestic violence, where a child is afforded no care or protection in their home. Bullying is when a person, who can be another child, seeks to threaten, harm, intimidate, or coerce a child. It is a form of abuse and harassment and can be done in person or via the internet or social media. It can involve digital pornography, such as posting intimate pictures of a child on the internet. It can also involve ignoring or isolating a child and often leads to mental health challenges such as depression. Children with disabilities are often subjected to higher rates of physical, emotional, and sexual abuse due to their vulnerability. They are also often subjected to bullying due to their disability and difference. Abuse of children with disabilities occurs when they are not cared for and protected properly, and when they are not given the services and support they need to become full and equal members of their community and society. Commercial sexual exploitation relates to any sexual activity involving a child in exchange for something of value or the promise of something of value. This includes prostitution, pornography, including digital or internet-based pornography, stripping, erotic or nude massage, phone sex, escort services, gang-based prostitution, interfamilial pimping, and any form of internet-based exploitation. This can also include child marriage, where a child is exchanged for a bride price, which is a form of harmful cultural practices. Female genital mutilation or circumcision involves the surgical removal of all or part of a girl's external female genitalia, or other injury to a female genital organs for non-medical reasons. It is a form of harmful cultural practices as it discriminates against girls and women and is driven by traditional beliefs in patriarchy and gender inequality. The surgery is medically unnecessary but driven by cultural beliefs and often causes a number of problems for the girl, including infection and death. In the long term, it can lead to significant health challenges, especially when it comes to childbirth and female reproductive health. Harmful male circumcision refers to the unhealthy removal of a boy's foreskin, usually during traditional manhood ceremonies. Male circumcision is not necessarily harmful to a child, but when it is conducted in unsafe and unhygienic environments, it can lead to infection and possibly amputation or death if the boy is unable to access adequate health care. In some societies and communities, children can become victims of accusations of witchcraft due to superstition, cultural beliefs, and fear. This can result in them being discriminated against, abused, stigmatized, isolated, neglected, and even killed, and is an example of a harmful cultural practice. Virginity testing is the practice and process of determining whether a girl is a virgin through the physical examination of her hymen. This is driven by cultural beliefs in patriarchy. It is a harmful cultural practice as it discriminates against girls. It infringes on their personal dignity and is often unreliable, which can lead to stigma and abuse. Child marriage is any marriage where at least one of the parties is under 18 years of age. Forced marriage is a marriage in which one or both parties have not personally expressed their full and free consent to the union. These unions often involve some form of financial or material gain for the parents of the family of the children being forced to marry, and exposes the children to the possibility of slavery, rape, and being denied an education. Child marriage is often a result of cultural beliefs and is an example of harmful cultural practices. The use of body parts in the making of traditional medicine is a harmful cultural practice. These body parts are often harvested in traditional ceremonies that cause enormous pain, suffering, and often death for the children involved. Children are often targeted for this form of traditional medicine due to their vulnerability and the incorrect belief that their innocence or purity will make the medicine or muti stronger. Creating or selling this medicine is a criminal offense. It is often linked to child trafficking and murder, and the medicine itself is often dangerous and poisonous when consumed. Harmful cultural practices is the umbrella term for all activities performed in the name of cultural beliefs that cause harm to a child. This includes the belief in patriarchy, or that men are more important and have more value than women or children, and practices such as female genital mutilation, harmful male circumcision, accusations of witchcraft, the use of body parts for harmful traditional medicine, virginity testing, and child marriage. A child-headed household is one where there are no adult carers available and children live on their own. Usually an older child will care for siblings, cousins, nephews, or nieces. These households are more common in areas with high AIDS mortality and regions affected by genocide or war. The challenge of having children taking care of children is that they often find it difficult to access social support due to their status as children. Child-headed households are often affected by poverty and struggle to access food, healthcare, and education. It is also difficult for children to take on the responsibility for the care and protection of their siblings, whilst also trying to study and develop themselves. This places an enormous amount of stress on the child caregiver. Street children leave their homes to live or work on the streets, locally remaining within their home countries, or travelling to bordering or other countries to seek employment opportunities. These children are often refugees living in poverty, with no care or protection from their families, communities, or the state. They are extremely vulnerable to exploitation through challenges such as child trafficking, child labour, and prostitution. Physical, emotional, and sexual abuse can also take place in the justice and care systems, such as in jail, in court, or in children's homes or foster care. Children can be victimized when trying to report abuse, as the investigative process is not designed to accommodate their vulnerability. Sometimes the criminal justice process can be abusive or amplify a child's experience of abuse, such as when court cases are unnecessarily prolonged, making the child relive their traumatic experience over and over again. Children can be exposed to many forms of discrimination, which is the unjust or prejudicial treatment of different categories of people. These different categories include sexual or gender-based discrimination, often driven by beliefs in patriarchy, racial or cultural discrimination, ageism, where they are discriminated against by virtue of their status as a child, sexual orientation, nationality, economic status, religious affiliation, political status, as in the example of discrimination against refugees and immigrants, and discrimination against disabilities and different ways of being in the world. Not giving children access to justice or legal protection is a form of child abuse. This can include being denied access to legal identity documentation, such as birth certificates or passports, not giving children access to legal recourse or representation, not respecting their rights to privacy, not protecting them from harm, treating them as criminal without cause, and subjecting them to abuse in the justice care system. Gender-based violence is violence directed against a person because of that person's gender, or violence that affects a person of a particular gender disproportionately, and is often a result of social norms about roles and behavior expected of each gender. It often occurs within relationships and can include physical, emotional, and sexual abuse, domestic violence, harmful cultural practices such as virginity testing, female genital mutilation or circumcision, and forced marriage. It can also include stalking, sexual harassment, forced abortion or sterilization, and unacceptable justifications for crimes, including crimes committed in the name of so-called honor. Many of these challenges are a result of cultural beliefs where one gender is prioritized over another, as in the case of patriarchy. Violence against sexual minorities includes violence aimed at individuals who identify or are perceived as lesbian, gay, bisexual, transgender, or queer, sometimes referred to collectively as the LGBTQI+ community. It can include physical, verbal, and sexual abuse, as in the case of corrective rape, bullying or isolation, either in person or online, and is often a result of ignorance or discriminatory cultural or religious beliefs. Many children are exposed to gangsterism, which is the culture of belonging to organized gangs of criminals, often from a very young age, in their own family or community. Gangsterism exposes children to extreme violence, rape, drug and alcohol abuse, criminal behavior, dangerous weapons, and the practice of corruption. Self-harming and suicide is the practice of injuring or hurting oneself either with or without the intent to die. A suicide attempt is when someone harms himself with an intent to end their life, but they do not die as a result of their actions. A suicide is when their attempts to end their life are successful. Self-harming can include eating disorders or abnormal eating behavior, cutting or burning oneself, drug or alcohol abuse, and asphyxia, and is often associated with depression. Addiction is an inability to stop using a substance or engaging in a behavior even though it is causing psychological and physical harm to oneself. A person can be addicted to drugs, alcohol, gaming, and sex, amongst other things. Addiction is associated with self-harming behavior and depression and can lead to domestic violence and family strife. Teenage pregnancy is when a woman under 20 years of age gets pregnant. It usually refers to teens between the ages of 15 and 19, but can include girls as young as 10. It is a result of young women who have started menstruating having sex without using any contraceptive protection. It is sometimes a result of consensual risky sexual behavior, but can also be a result of non-consensual incest or rape. Young girls often don't know that they are pregnant until well into their second trimester and don't or can't access appropriate medical care and support. They are often isolated and ridiculed by their family and community, and it can have a detrimental impact on their ability to complete their schooling or education. Some young women are treated very badly when they fall pregnant, even if their pregnancy is a result of incest or rape. They can be physically and emotionally abused, lack financial and medical support, and be isolated and stigmatized for their condition. At a time when they need more support than ever, they are often denied the love and care of their partner, family, and community, and this can result in them making desperate decisions such as late abortion and child abandonment. As children are vulnerable, they are often more at risk in times of social unrest. Social unrest includes acts of civil disorder, mass civil disobedience, riots, war, or any armed conflict. This includes gangsterism and terrorism, which are often a result of economic inequality and political or religious intolerance or opposition. In these environments, children are at risk of being exploited through challenges such as the use of children for acts of terrorism, as child soldiers, or as participants in gangsterism and organized crime. Children are also vulnerable to radicalization and terrorism, which is the action or process of causing someone to adopt radical positions on political or social issues. Children are encouraged or forced to destroy property, harm other people, or take part in armed conflict or organized crime and gangsterism, often under the guise of religious, cultural, or political difference or intolerance. Not respecting or protecting children's individual freedoms and liberties is also a child protection challenge, often driven by a lack of respect for children and their role in society. This includes not allowing children freedom of expression, association, religion, sexual orientation, or creativity. Children are often unfairly discriminated against in the sphere of gaining financial freedom through being denied educational or career opportunities. Once you have gone through all the child protection challenges and prioritized them, you should have 4 piles of cards or 4 lists. These different piles or lists will help you to prioritize which problems need to be addressed in your community, starting with your high priority challenges, followed by your medium priority challenges, and finally your low priority challenges. The pile of challenges that do not exist can be put to one side, but it is useful to understand what these challenges are, so that if they do start to appear, you can recognize them and address them accordingly. Here we can see workshop participants placing their cards into high, medium, low, or does not exist piles. This is an important step in building understanding in the process of change. Thanks for watching. For more information, visit couragechildprotection.com. Be sure to like this video and subscribe to our Courage channel. Stay strong and take courage.